So this is our fourth and final episode of the Sustainable Development Goals podcast. If you've come this far and listened to all the episodes, thank you so much for listening. But yeah, this episode is going to be focused on health and the goals relating to health. So the goals we have under this are zero hunger, good health and well-being, and clean water and sanitation. So let's begin with zero hunger. So the main focus of this is to end hunger, achieve food security, and improve nutrition, and promote sustainable agriculture. So sort of like as like a massive sort of like storm is like we have conflict, COVID-19, climate change, and inequalities, which are all stuff and like issues we've talked about in previous episodes. All of these come together and undermine food security. So 1 in 10 people are suffering from hunger, and then 1 in 3 people do not have like stable or adequate access to food. The Ukraine crisis has also exacerbated the food crisis, as Ukraine slash the Russia have provided a lot of the world's wheat or maize before the crisis, and that obviously has been stopped now due to the Ukraine crisis. So how to help? We can pass laws and lobby representatives to keep food prices low, especially in areas where there is like a lack of access to food. As we were talking about before, making sure we're not like wasting food, like not taking more than we need, like, and making sure that we're not just like we're thinking about like what we're eating, and also like like the impact of like, hey, if you live in like a developed country where like in the place where we live in, we have like access to food like all the time. We are not in a food insecure place. So it's sort of like thinking about like, hey, what could this food be better used for, than just like if it's gonna get like thrown out.
Yeah, there's also some, like, you can check with some local libraries. There are some places that have food, like lockers and stored stuff for people who can't necessarily buy foods because they are expensive. And so making sure and like being aware that you can donate food, and also not just canned food. Like canned food is very helpful because like shelf safe, but also making sure that you're providing to local groups who provide food.
We can also provide subsidies to small farmers in order to increase productivity. And then we can also develop or research new ways to have like sustainable agriculture. Obviously, we need more food for all, but we don't want to like hurt our planet while doing it. So that's something we can like focus on, is like scientific research into sustainable agriculture. Our second goal is good health and well-being. So the main focus of this is to ensure healthy lives and promote well-being for all at all ages. So, obviously the main like sort of elephant in the room with this goal is that COVID-19 has caused major setbacks in global health progress across like all areas. Like, I believe it's like there's been an increase in like depression or anxiety, an increase in like tuberculosis and malaria, a decrease in like vaccines, and like overall it's just like bad.
Polio's back.
Yeah.
So is measles.
Yeah. 22.7 million children missed basic vaccines in 2020, and by basic meaning like the stuff you get when you're like born, like
because it wasn't safe to bring a lot of babies to hospitals.
Yeah. So
yeah.
we need to like, so how to help? Well, all countries must obviously like prioritize vaccine supply towards like the COVID vaccine in order to prevent more deaths. I believe in our research we found that 15 million people like somehow like COVID-19 caused them to die, even if it wasn't like they had COVID-19, like something affecting COVID-19 like caused them to pass.
Filled the hospitals. That's why it's very important to like be mindful of the spread in your area, and like remember those policies that we had in place in earlier COVID. If the numbers start skyrocketing again, be prepared to like be distant from others, because it's very important that the hospitals do not get overrun, because when the hospitals are overrun, other health issues are caused. Like if there are no free hospital beds, if you get into a car accident, there are no hospital beds for you. So it's really very important outside of just the disease.
Yeah. We also need to focus more investment on mental health resources, especially after the COVID-19 pandemic, like even before like the pandemic, but especially now, like during the pandemic. It's like, hey, people have been stuck inside for like that for like many months. That's gonna do something to your mental health for sure. So like even if some governments might think that it's sort of like, oh, it's like silly or it's not a real issue, like it is a real issue and it's costing people's lives.
For sure.
We also need to lobby governments for universal healthcare coverage, which will solve a lot of inequities between people with different financial situations related to health. Just because you might not make as much money as someone else, that should not mean you get any less like quality of care if you're injured.
Exactly. You see that too with like politicians or like richer people, where it's like they can take way more risks than those who don't have as much healthcare because they know that they'll get like top of the line healthcare.
Yeah.
If they get sick.
Yeah. We also need to educate people about the importance in vaccines in general. Like, obviously, as Elizabeth was saying before, a lot of diseases that we thought we had like gotten close to eradicating or coming back because
like polio.
That people are just being like not vaccinating their children because they think it's gonna cause like a common claim is that it's gonna cause autism, which is obviously not true.
It's not true.
So
and also like there's like ableism there too. It's like you would rather have your kid like die than have autism.
Yeah, exactly. Which is sort of just a variety of issues relating to that. So we really need to like educate people starting from a young age about like the importance of vaccines. Like, hey, this is protecting you more than anything. Like,
yeah, like get vaccinated. Check your if like you're not sure if you're vaccinated, you can probably check your records if you have insurance. Like the polio vaccine, not everyone got it. I don't think like it that's an important one because polio is naturally occurring. It's in waterways. So especially if you're traveling to New York or Illinois, check up on that.
Yeah. And also just like overall like saying like, yes, there is like some people do have allergies to certain things in vaccines, but that's like a low amount of people. Like you do not need to be like super scared that your child has that. And if they do, then like there are ways to move around that. And then also for people that don't have allergies, herd immunity.
That's the entire point of getting vaccinated. And that's, I think, the thing, like, one of the things that went wrong with COVID-19 is we jumped on herd immunity before we even reached, like, when people are like, well, herd immunity counts if you get sick, right, with COVID. And you're just, like, you have that natural immunity for, like, 6 extra months. But also studies show that the more you get COVID, the worse the symptoms are. It's not exactly like the flu where you get it and then, you know, it's relatively around the same. And also the flu is pretty deadly. But you have to be mindful, like herd immunity does not equal, oh, we've all had it before, we're fine. It equals you are vaccinated and you have tested.
Yeah. Okay. Our final goal for this podcast and our final goal overall for the SDG podcast is clean water and sanitation. So for this goal, we have ensuring availability and sustainable management of water and sanitation for all. So first off, over 85% of the planet's wetlands have been lost over the past 300 years. So essentially, since like industrialization started, we have lost like a ton of wetlands and a ton of like clean water resources. In 2030, 1.6 billion people will lack safely managed drinking water, and 2.8 billion people will lack safely managed sanitation. So, and then today, 3 billion people don't know the quality of their drinking water, like, which is just, like, insane. Like, that's almost half of the global population just, like, doesn't know, like, what they're drinking, you know?
Yeah, no. They also, like, where I, like, my neighborhood, they don't really tell us when they're doing testing on water or, like, moving something. Sometimes they'll, like, turn the tab on and it's brown, and I'm just like,
Yeah, like...
fun.
Yeah, which is obviously just like governments need to keep their people informed about like what's happening with your water, like how is the quality of your water, like overall, like can you drink from the tap, and like
why does this taste off, and you test it and the pH is like out there.
Yeah, and generally like the global implementation rate of clean water practices like needs to double in order to make sure that everybody has like clean water and like secure access to water. Like water is like the most important thing. Like you should not have to like be like searching for water. Like it should just be there, you know? Like
yeah, everyone should have access to it.
Yeah, governments also need to like collaborate with other countries where they share water borders to keep like water clean, like, because if you're polluting the water, you're polluting everyone's water. Like, that's just how it works, especially if it's in the oceans. Like
with like also pipelines too, like
mm-hmm.
especially like with indigenous populations where like
Mm-hmm.
they're advocating so hard for like their waterways that literally sustains so many people, and we're just like, no, we're gonna plow through with oil.
Yeah.
Because that's more important, which again goes back to sustainability. Like, if we had sustainable practices, the water would not be compromised.
Exactly. We also need to divert funding towards active water monitoring, like, agencies and least developed countries, because it's sort of like, hey, they don't really have, like, they have other things they need to focus on than, like, water monitoring the, like,
content of the water.
Yeah, but, like, that's important. So, like, we need to, like, help these least developed countries, like, monitor their water, like, make sure their people are getting, like, safe drinking water, and they're not gonna, like, get, like, E. coli or, like, cholera or something like
things
that.
Like that. Or, again, polio, but that's more here. It's just, like, making sure that the waterways are safe. And, like, also having another issue is, like, restrooms and stuff that diverge away from water and don't have sewage waste going into waterways, because that is a thing that we have, but that's like number one ways of like cholera, E. coli, like all of those things like spread through the waterways.
And then finally we have questions to consider.
Are making the world more sustainable and improving health, reducing hunger mutually exclusive?
Definitely not. Like, we just need to like come up with the scientific like ways, and even now, like, we can like think of ways to like make sure that people have enough food and we're not like destroying the environment. Like, this is like an easy problem to solve if we put our minds to it.
And I think it's just like being just like sustainable with it, as well as like will be more longer lasting. Like, if you know anything about like the Dust Bowl, like stuff like that can happen if you're not having sustainable practices and you're just focusing on output.
Next,
what are some possible ways of making anti-vaxxers more open to the idea of vaccines? That one's difficult.
That is difficult because
it's like the thing where it's like if you're trying to convince someone of something, they're gonna lock into their beliefs more.
Yeah.
And it goes back to education.
Yeah.
And also like if the government.
And it's also like an emotional thing. Like, it's based on not facts, because any facts that they say they're based on are just like not true. Like, this is like,
well, there's also some anti-vax movements within some marginalized communities out of distrust from the government because of human testing and different things like that. And I think like the government like owning up to things like that and also being more honest with the general populace will also help.
And also just like making sure like going forward, like ethical testing, like,
it's hard to do ethical testing because like what you need with different groups, it's just like one, also human testing is not allowed.
But even like ethical testing on animals, like, that's something we've talked about a lot in my psych classes. Like, we need to like find a way to like
ethically test, because like animals, like animal cruelty and animal testing are bad things, and it's like also trying to find an alternative for that, and a lot of the alternative for that is like human testing, which we cannot do. So finding the balance.
We also need like possible, and then going back to like possible ways of making anti-vaxxers more open to the idea of vaccines, we need like educating people on vaccines, which is what we touched on earlier. If you start with like children and you're like, hey, these vaccines are good, like, here's why they're good, here are some of the risks, but like here are the obvious benefits,
And like some of the like not full anti-vaxxers, but some people who like will get vaccinated but maybe not necessarily get the flu vaccine, because it's really just like, why do I need to get that every year? Shouldn't it just work like the tetanus or anything like that? And it's just like having a general understanding of how these work and how like some viruses mutate faster. Like COVID, we're going to be getting vaccines from, it's endemic, so we're going to be seeing those vaccines for a long, long, long time. And so having that general understanding that everyone needs to get vaccinated when recommended, and that it's not a silly thing to do, just making sure that we're an educated populace is very important.
Yes, for sure. And then our final goal of our final question of the Sustainable Development Goals podcast is,
relating back to the 17th goal, how can countries work together to make sure that there is clean water for all?
So obviously, countries share like water like ways, like So
there are
making
wars about it too.
making sure that like if you're a country and you're like, hey, I'm not polluting my water, or at least I don't think I'm polluting my water, I'm like making sure I'm putting in practices that don't pollute my water. Talk to countries that also share your water and being like, hey, please don't pollute the water because then we're also gonna get polluted water. It's like about making sure that people like know and like governments know it's like, hey, this is like something like that's like extremely global. Like this is so interconnected between different countries. Like just making sure that people have clean water.
And the other thing is like just a general understanding that the world is not just like nations' borders. Like those are real things, but also like waterways, viruses, those things don't really care about borders. And so working with each other for like water, even if you have like a tough relationship with other countries, at least trying to strive for sustainability in that way is so helpful because like the lives of the people of both of those countries are more important.
Okay. Yes. Okay. Thank you so much for listening to our podcast. This is our final episode. We really appreciate everyone that's listened. So thank you so much.
Thank you.
Bye.
Bye.